Good afternoon. The first item of business this afternoon is portfolio questions. The first portfolio is Rural Affairs, Land Reform and Islands. A reminder that any member wishing to ask a supplementary question should press the request to speak buttons during the relevant question. I can advise the Chamber we are very tight for time across the afternoon, so I will need brevity in questions and responses in this portfolio and the next one. And I call question number 1, Annabel Ewing.
Presiding Officer, to ask the Scottish Government when it last met with supermarkets to discuss the stocking of Scottish own brand products.
Cabinet Secretary Marie Goujon.
I met with senior grocery retailer representatives most recently at the Royal Highland Show in June to discuss some of the good work that's been undertaken to support Scottish suppliers, as well as then looking at ways of further increasing the volume of Scottish produce available on store shelves. Furthermore, we've committed £10 million over the period of 2023 to 2025 to support delivery of Scotland's food and drink strategy, Sustaining Scotland, Supplying the World. And this funding facilitates a range of activities and direct engagement with grocery retailers to really try and help increase the volume of Scottish food and drink on retail shelves, including own brand products.
Annabel Ewing.
I thank the Cabinet Secretary for her answer. However, the Cabinet Secretary will be aware that the NFUS most recent Shelf Watch report, published last week, showed a decline in the stocking of Scottish branded produce in all leading supermarkets except Lidl. This shortchanging of our farmers and crofters, as well as our consumers, is surely simply unacceptable. So can I therefore ask the Cabinet Secretary what further action the Scottish Government will take as a matter of urgency to get the supermarkets operating here in Scotland to step up?
Cabinet Secretary.
I want to thank Annabel Ewing for raising that really important point, and I think for highlighting the work as well that NFUS undertake, which is really important monitoring through their Shelf Watch campaign. And I think it is, of course, disappointing to see the outcomes of that and of the most recent Shelf Watch. But I think I would want to assure Annabel Ewing that through the strategy that I mentioned in my initial response, we do have that strong engagement with all major retailers, and we are doing what we can to support them to get more Scottish food and drink onto supermarket shelves. But I would also add to that we are doing a range of work right across the retail, whether that's from our major retailers as well as our smaller and local convenience stores too, as well as wider wholesale, because we want to support the stocking and sale of more local Scottish produce and Scottish suppliers. Now, I think we are fortunate in Scotland that we have one of the best natural larders in the world, so we obviously want that to reach as many consumers as possible and to make it as easy as possible for them to access, and we'll continue to do all we can to enable that.
Thank you. And a brief supplementary. Mercedes Vialba.
Thank you, Presiding Officer. The Minister will be aware that Nature Scot estimates that an increase in the national cull of 50,000 deer each year will be needed to meet the targets in the Scottish Biodiversity Strategy. So what discussions has she or the Government had with supermarkets about bringing this abundant resource from our natural larder to the Scottish public?
Cabinet Secretary.
Again, I think the member raises a really important point, and I think it is something that we want to see more of in supermarket shelves. Now, through Forestry and Land Scotland, we have agreements with one business in particular in terms of the deer that they can access, which is available in our supermarkets. But we want to make sure that this is a resource that people in Scotland can enjoy and make that as accessible to people as possible. So we'll continue to do all we can to try and support that.
Question 2, Kevin Stewart.
Thank you, Presiding Officer. To ask the Scottish Government whether it will provide an update on what its position is on the use of neonicotinoid pesticides.
Minister Jim Fairley.
Thank you, Presiding Officer. The Scottish Government takes the potential impact of the use of chemicals on public health and the environment very seriously. We continue to support the regulatory decisions taken to restrict the use of neonicotinoid insecticides due to their environmental effects, particularly on bees and pollinators. These pesticides have not been used in the Scottish crop protection since their approval was withdrawn. The pesticide products authorised for use in Scotland are tightly regulated and are subject to thorough analysis by the Chemicals Regulation Division of the Health and Safety Executive before authorisation to demonstrate that the product is effective and poses no unacceptable risk to people, animals or the environment.
Kevin Stewart.
Thank you very much, Presiding Officer, and I thank the Minister for that answer. I have the only constituency in the north east of Scotland with no farms, but what I do have within Aberdeen Central is a number of beekeepers, and obviously beekeepers are worried about the use of neonicotinoids and their effect on pollinators. I'm pleased to hear that the Scottish Government will continue to keep a tight rein on the use of these pesticides. And I wonder if the Minister could tell us what discussions he's had at UK level to make sure that these pesticides are not used in these islands.
Minister.
Well, whether they're used in these islands or not is a matter for the UK Government. The Scottish Government can only do what we are doing here. There are a range of monitoring strategies that we operate in Scotland. Pesticide usage patterns are monitored by our pesticide usage team, who perform annual surveys to estimate Scottish pesticide use on a range of agriculture and horticultural crops, and a lot more besides. If the member wants to know any more, I'm more than happy to meet him to talk about it.
Yeah, and briefly, Finlay Carson.
Could the Minister update the Parliament on progress to find a replacement for Azulux in the control of bracken?
Minister.
As the member knows, there are a number of issues being looked at around the control of bracken, and we can update that as we come to some conclusion.
Thank you. Question 3, Tim Eagle.
Thank you, Presiding Officer. To ask the Scottish Government how its Marine Directorate monitors international fishing vessels.
Cabinet Secretary.
The Directorate monitors fishing activities using its network of coastal-based officers, marine protection vessels, surveillance aircraft and a 24-hour monitoring centre. And inspections on all vessels are determined using either a risk assessment process, which considers fleet types and impacts but not nationality, or assurance inspections. The monitoring of vessel landings involves ascertaining the quantities and species by counting and observing any weighing of fish and checking the results against mandatory pre-landing electronic documentation. And additionally, post-landing checks are undertaken focusing on vessels which do not land into a Scottish port, and these require collaboration with inspection agencies from the landing or flag states.
Tim Eagle.
To see a thriving fishing sector that makes the most of all opportunities. However, there is a part of the industry that is concerned that some landings are not correctly recorded. It is vital for our fleet that our data is fully robust and there is equality in monitoring. One of the concerns is where EU boats return to land in their own European ports. Now, last year, Scottish-UK authorities negotiated with the Faroe government for Faroe vessels exiting UK waters and vice versa to make their way to a predetermined point for inspection before exiting our EEZ. Has the Cabinet Secretary, working within the UK and Scottish authorities, contemplated putting in place similar plans for EU vessels leaving UK waters to land their catch elsewhere, as this might help establish some kind of control in this area?
Secretary.
Thank you. And I think the member raises really important points in his question, and I think I agree with him when he says that about wanting to see a thriving fishing sector, because I absolutely agree with him in that. And I would say that the control areas that Tim Eagle mentioned are currently part of the agreement that we have with the Faroese demersal and mackerel fisheries, as well as through a Norwegian mackerel agreement. And they have actually worked particularly well in the recent mackerel fishery, because vessels were directed to a control area where they were inspected by either a marine protection vessel or by coastal officers in port. But what I would say is, though, that the control areas are really resource intensive, and it can limit the availability of the assets that we do have to inspect vessels while they're fishing. Marine Directorate officials do have and regularly use the powers to require a vessel to move to an area to facilitate an inspection, and all non-UK vessels that are departing UK waters have to electronically submit the time they want to exit, as well as the quantity of fish that they have on board too. So this allows for the targeting of vessels prior to them exiting UK waters. So we want to say that the control areas have worked well. We're continuing to look at how we can improve that, but it's the resource considerations we need to take into account.
Supplementary, Beatrice Wishart.
Thank you, Presiding Officer. An FOI response in August showed that out of 81 Marine Directorate job posts advertised, only 27 were filled, and I've previously raised concerns with the Cabinet Secretary about the state of the organisation's laboratory building in Aberdeen. Does the Cabinet Secretary agree with me that without a fully staffed team and adequate resources, the Marine Directorate will struggle to fulfil its remit, including appropriate monitoring of landings by non-UK fishing vessels?
Cabinet Secretary.
Of course, the Marine Directorate covers a wide area, so I think in terms of the job vacancies there that the member mentions, I would have to look into that in a bit more detail. But the member quite rightly raises the Marine Lab in Aberdeen, and we discussed this at some length at committee as well, because I recognise how important these facilities are and that we keep those facilities in a good order. Now, there has been a project board underway within the Scottish Government to look at the overall long-term plans for the site, and that work is still underway and under consideration. But of course, we want to try and upgrade those facilities as best we possibly can to provide a good working environment for the staff of the Marine Directorate.
Question 4, Sharon Dowie.
Thank you, Presiding Officer. To ask the Scottish Government what action it is taking to support farming businesses that are seeking to diversify.
Minister.
Thank you, Presiding Officer. The Scottish Government strongly supports farming businesses to diversify, providing businesses with a range of income streams and stimulating the rural economy. We provide support to plant and manage trees. We give advice, events and courses on business resilience and diversification through the Farm Advisory Service and the Skills Hub Scotland. Funding to Scottish agritourism to assist agritourism businesses that keep multiple generations of farming families in employment in rural areas, which is really important. And we support to help businesses promote and sell their produce locally and regionally. Unfortunately, the UK budget decisions are having a really damaging impact on their ability to fund measures on a multi-year horizon, and that's the kind of horizon that agriculture needs.
Sharon Dowie.
Annually, farms which have diversified bring millions of pounds to Scotland's economy, from farm shops to garden centres, milk vending machines to coffee shops and camping pods. However, the rural location means infrastructure and signage is key to allowing customers to find them. Businesses face major barriers in obtaining signage for opening up, but also directional signage when improvements are made to main roads. The Coo Shed in my local area received no prior communication that their main access road was to close for 4 months, impacting customers, farm suppliers, milk tankers and their sales, causing unnecessary stress and anguish. What discussions can the Minister have with her colleagues in other portfolios to make major improvements to this process?
Minister.
That's a really important question that Sharon Dowie was asking, and I take it in the way that it's been given. As far as the signage is concerned, that's a transport issue, and I will take that away. As far as the access to a local business, that's a really specific area, and I'm more than happy to meet up with the member to discuss what that is. But I have connectivity in my portfolio, so I will follow up on the specific issues in terms of what the signage and what we can do to help that.
5, Marie McNair.
Presiding Officer, to ask the Scottish Government what it's doing to promote the Scottish food industry.
Cabinet Secretary.
Scottish Government funding towards the food and drink industry strategy, Sustaining Scotland, Supplying the World, supports a range of measures to promote Scottish produce at home and internationally, showcasing our remarkable food and drink businesses to wider audiences and markets. And a key example of this is the Showcasing Scotland Global Sales event held in March in Edinburgh, which connected over 100 top international buyers with more than 100 Scottish businesses, and it generated a potential £77 million in sales for Scottish food and drink producers.
Marie McNair.
I thank the Cabinet Secretary for that answer. In a joint statement, the Scottish Pelagic Processor Association and the Scottish Seafood Association has recently stated that Labour's UK Government's increase to national insurance contributions could threaten the seafood industry in Scotland. Can I ask the Cabinet Secretary what discussions they've had with the UK Government about the impact this could have on Scotland's food industry?
Cabinet Secretary.
Marie McNair raises a hugely important point, and I think it's fair to say that food and drink businesses, our third sector, right across the piece, everybody is struggling with the impacts of the decisions that have been taken in the UK Government's budget. Now, of course, the member would be aware that the Scottish Parliament, in a number of debates that we'd had over the course of November, had called on the UK Government to urgently commit to undertake and publish impact assessments on its budget announcements. But I would just want to highlight to the member and more generally across the chamber that together with the Finance Secretary, Shona Robison, we've written to the UK Treasury to outline our serious concerns about some of the proposals in the UK Government budget and the far-reaching impacts of that. And of course, Scottish ministers will continue to make those representations to the UK Government. We have regular ministerial meetings through the interministerial group where we will continue to raise these matters.
Thank you. Question 6 was not lodged. Question 7, Stephen Kerr.
To ask the Scottish Government regarding the potential impact on agriculture, what assessment has made of the number of family farms in Scotland that will incur inheritance tax liability as a result of changes announced in the UK budget?
Minister.
Thank you, Presiding Officer, and thank you very much to Stephen Kerr for raising this issue again. Our officials have met with representatives of the sector and the UK Government officials to determine the impacts of this policy change on family farms in Scotland. But given the lack of available data on the impact of the decision, there has to be an immediate reversal and a review of this policy. That should then follow by close engagement with the agricultural sector and the devolved parliaments so that we can get a proper understanding of what this is actually going to do to family farms. There are early estimates that suggest around 5,000 farm businesses in Scotland are likely to be worth over £1 million and potentially impacted by this change. But due to the limitations of data on tenancies, we are unable to provide a separate estimate of the number of tenant farmers affected by this change at this time.
Stephen Kerr.
I'm grateful to the Minister for his reply. I've done a calculation based on the UK Government's assessment that 28% of farms overall will be impacted by their family farm tax grab, and that would make it about 12,000 potential family farm businesses impacted. Now, Labour's family farm tax is going to have a devastating effect on the future of family farms in Crofts. Scottish Land and Estate said these measures threaten the immediate viability and future sustainability of thousands of rural businesses across Scotland. But on top of Labour's blow, the SNP budget was a bitter disappointment. The SNP is accused by the sector's representative bodies of failing to back rural Scotland, cutting funding in real terms and failing to treat rural Scotland with seriousness. How does the Minister expect the sector, given the challenges it now faces, to remain attractive for the next generation of farmers, especially given the dearth of new entrants? And what specific steps will the Scottish...
Thank you, Presiding Officer. I think the first point of Stephen Kerr's speech actually highlighted the fact that there are so many different proposals around how we analyse and what's actually happening within the sector that the UK Government have to reverse the decision to do a proper impact assessment to allow us to know exactly what it is that is happening in the Scottish family farming sector. In terms of his second point of his speech, this Scottish Government has actually maintained the full level of funding that came from the UK Government, but it was actually his government who ceased to increase the level of funding. It was his government who took us out of the EU, who gave us the multi-annual year funding that was guaranteed for 7 years. It was his government who did all of that and yet has the audacity to sit in this chamber and try and criticise the Scottish Government. Thank you, Presiding Officer.
A couple of brief supplementaries. First, Emma Harper.
Just to build on that, Presiding Officer, would the Minister agree that in addition to the uncertainties brought about by the proposed inheritance tax changes, this is in addition to the damaging policies taken by current and previous UK Government, including reckless trade deals which undercut our Scottish farmers?
Minister.
Yes, I agree with everything that Emma Harper has said. The Scottish industry is so vital to rural Scotland. This Government has continued to give its full weight and support behind the industry, and we will continue to do so.
And Willie Rennie.
I'm against the inheritance tax changes for the agricultural sector. I think they'll have a devastating impact. It's not good for farming. But the Minister can't simply say that the Government has to reverse it, which I agree they should reverse it. But he's got to have much more practical plans about how he's going to deal with the consequences of it. And if he doesn't understand what those consequences are, what hope does the farming sector have of looking to the Scottish Government to come up with some answers? For instance, what it's going to do on its land reform proposals? What's going to change on that front if these measures go through?
Minister.
I think Willie Rennie has gone about 5 steps forward there without actually... The fact that he accepts that we must reverse this decision in the first place until there is a full assessment, because there is a policy objective behind what the Labour Party have done, which may not be a bad thing, but they have completely misunderstood family farming in Scotland. They have completely misunderstood the thresholds to which we have to be working to, and they have completely misunderstood the effects that this is going to have. So for them to ask us to find solutions to that, I think is a little bit off. So therefore, let's get the UK Government to actually sort this mess out in the first place, and then we can start working forward from there.
And question 8, Christine Graham.
Thank you very much, Deputy Presiding Officer, to ask the Scottish Government what assessment it has made of any specific impact on tenant farmers in Scotland of the announced changes to the agricultural property relief on inheritance tax.
Minister.
Presiding Officer, over half of Scottish agricultural tenancies are secure, heritable tenancies, and they're a unique feature of Scotland and may be disproportionately affected by the inheritance tax change compared to other parts of UK agriculture. Now, Scottish Government officials are due to meet HMRC officials to discuss the impact of these changes on this particular group. And the Scottish Tenant Farming Advisory Forum have written to the Treasury and the Secretary of State for Scotland to highlight this particular issue. And I believe that the inheritance tax powers should be devolved to the Scottish Parliament so that the tax decisions could be designed and tailored in a Scottish context. And as the Cabinet Secretary has already pointed out, both herself and the Finance Secretary have also written to the UK Government to ask them to stop this damaging process.
Christine Graham.
I thank the Minister for his answer. As we know, these are family farms, worked through the generations. It's not an ordinary job or business, it's a way of life. And many of these families will now be worried sick as to whether they can continue to the next generation. Does the Minister agree with me that the irony is that if these are taken over by individuals not to farm, but to reduce their inheritance tax liability, do a Jeremy Clarkson, if you like, then it's helped the rich hobby farmers at the cost of the real farmers. Does Sir Keir Starmer understand rural Scotland at all, Minister?
Minister. I think the straight answer to that is no. But the Scottish Government really shares the concerns around the potential impact of these imposed tax changes, and it is committed to working closely with our partners to fully understand their implications. As I said, officials are already working with the tenant farming stakeholders and the Scottish Land Commission to start to try and assess the range of impacts from these imposed tax changes. And the Scottish Government has been clear with the UK Government about these concerns, and we will continue to emphasise them. And there is a meeting with HMRC this week. It's scheduled to go ahead this week to gain further clarity on the potential effect for tenant farmers.
Thank you, Minister. That concludes the portfolio questions on rural affairs. I would note that the member that had question 2 then subsequently left during the course of portfolio questions. I am very disappointed to see that. I will expect both an explanation and an apology. There will be a brief pause before we move to the next item of business to allow front benches to change. Okay, the next item of business is portfolio questions on health and social care. Again, members wishing to ask a supplementary question should press the request to speak buttons during the relevant question. I call question number 1, Alexander Stewart.
Thank you, Presiding Officer. To ask the Scottish Government what action it's taking in light of recent statistics which show that a record number of people are waiting over a year for heart disease treatment.
Cabinet Secretary Neil Gray.
Thank you, Presiding Officer. We remain determined to drive down waiting times. Our proposed budget, set out on the 4th of December, allocates almost £200 million to reduce waiting lists and help support the reduction of delayed discharge. By March 2026, we expect no one to be waiting longer than 12 months for a new treatment. Our Heart Disease Action Plan seeks to ensure everybody with a suspected heart disease issue to have timely and equitable access to diagnosis, treatment and care here in Scotland, and progress to date includes supporting the effective use of data to drive improvements and the development of nationally agreed pathways of care.
Alexander Stewart.
I thank the Cabinet Secretary for that response. In June, the Cross-Party Group on Heart and Circulatory Disease published a report of its inquiry into Heart Disease Action Plan. Clinicians reported an encouraging work going on across Scotland to innovate and improve services, but the ability to implement these across all health sectors and all health boards was suffering due to a lack of funding. So can I ask the Cabinet Secretary now to commit to increasing the focus on investment and the contribution that remains and conditions that remain across Scotland, because this is Scotland's single biggest killer, Cabinet Secretary.
Cabinet Secretary.
Thank you. I thank Alexander Stewart for his question. Initial funding of £2.2 million over 5 years was provided to support the Heart Disease Action Plan from 2021, and then we've committed to enabling a transformational shift in the use of cardiac data, and that's why we commissioned the Scottish Cardiac Audit Programme that was investing £1.5 million over 5 years. In addition to that, the Chief Medical Officer, Sir Gregor Smith, that currently chairs a newly established cardiovascular disease risk factors programme, which is about preventing people contracting a cardiovascular disease in the first place, and that seeks to improve the public and community understanding to transform the models of care for the identification and management of these risk factor conditions, and I hope that helps to alleviate the concerns that Alexander Stewart may have.
A couple of supplementaries. First, Joe Fitzpatrick.
Thank you, Presiding Officer. Well, the area that Alexander Stewart raises is, of course, of particular concern to Scotland. Long waits for any patients are unacceptable, and urgent action must be taken to reduce waiting times across our NHS. Can the Cabinet Secretary say anything about the work the Scottish Government is undertaking to help boards across the country provide additional procedures and extra appointments?
Cabinet Secretary.
Yes, I can. I appreciate Joe Fitzpatrick's interest in this issue. All long waits are regrettable. I apologise to any patient who has had to wait too long for treatment, or indeed any clinician who is having to explain that long wait to their patients. We are working hard to drive down waiting times. This year, our £30 million additional investment will deliver around 12,000 new outpatient appointments, around 12,000 inpatient procedures and over 40,000 diagnostic procedures. And as part of the 2025-26 budget announcement, we're allocating £200 million to help clear long waits, improve capacity, and that will help drive that vital progress. And the funding will be targeted at specialties with the longest waits and ensure that by March 2026 no patient will wait longer than 12 months for a new outpatient appointment or inpatient or day case procedure.
And briefly, Jackie Bailey.
The NHS is stretched to breaking point in the Scottish Government's promises to bring down waiting lists, including those for heart disease treatment, lie in tatters. Long waits of over a year were supposed to be targets to remove them, were supposed to be met by September 2024, but the Scottish Government have failed to meet this. In England, there are 113 people waiting more than 2 years, but in Scotland, that figure is more than 11,000 people waiting the same length of time. In capita terms, Scottish waiting lists are 1,000 times longer. Does the Cabinet Secretary want to apologise to the people of Scotland for the SNP's failure?
Cabinet Secretary.
I've already said, in response to Joe Fitzpatrick's question, that for anybody that's waiting for too long for treatment, I apologise, or indeed to any clinician that's having to explain those long waits. Of course, I apologise, and that's why the investment that we're taking forward through the budget, that I would encourage Jackie Bailey to support, because she recognises the need for us to drive down long waits, but she cannot will the end without willing the means, and so thereby the Labour Party needs to support the budget to ensure the funding gets in place so that we can get these waiting times down.
Question 2, David Torrance.
Thank you, Presiding Officer. To ask the Scottish Government whether it will provide an update on how it is working to improve access for children and young people to mental health services.
Minister Marie Todd.
The Scottish Government is committed to ensuring that everyone has access to mental health support when they need it. We have supported increased mental health spending and seen the best ever reporting in national performance against the 18-week CAMHS waiting time standard since the standard was introduced in 2014. Additionally, we've provided councils with over £65 million since 2020 to develop and fund community-based supports for children and young people. Nearly 83,000 children, young people and family members access these early intervention and prevention services between July 23 and March 24. We also provide £16 million a year to local authorities to ensure that children and young people have access to counselling through every secondary school in Scotland.
David Torrance.
I thank the Minister for that answer. Can the Minister please outline how the Scottish Government will continue to invest in our local authorities and health boards to ensure that young people have quick access to support they need when they need it?
Minister.
We've allocated £120 million to NHS boards and IJBs to provide a single, flexible funding stream, supporting continued improvement and better outcomes across mental health services, including in CAMHS. Now, as part of our effort, as I explained, to embed early intervention and prevention, our £15 million per annum investment in community-based mental health and wellbeing supports and services for 5 to 24-year-olds and their families will be baselined in local authority budgets from 25-26. Over 300 services are now available across Scotland, and we will also continue to ensure access to school counselling services, which benefited over 14,000 pupils in the first half of 23 alone.
There's a lot of interest here. I'll get through as many supplementaries as I can, but they'll need to be brief. First, Brian Whittle.
Thank you, Deputy Presiding Officer. Some of the CAMHS waiting lists now sit at 5 years, so we really need the support of the third sector. We have 2 local third sector mental health organisations in my area were in danger of closing because of lack of funding from local council. Isn't the issue that the third sector are generally financed through the local council, whereas statutory services are financed through the NHS? So how can the Scottish Government ensure that these vital third sector organisations are properly funded and ensure that more pressure is not heaped on statutory services?
Minister.
So firstly, let me be absolutely clear. We have seen in the last quarter of this year reported, so that's up to September this year, the best ever performance for CAMHS reported since the 18-week standard was introduced in 2014. There are challenges with ND assessments. We don't collect sufficient data on them, and we need to improve that. But actually, let's be clear, the CAMHS situation, which has been very difficult for a very long number of years, is now in very, very close. It's less than 1% off target. In terms of the community services, I absolutely agree, and we've invested an extra £1 billion into local authority budgeting this year, which will definitely have an impact on that. As I set out in my first answer, we have specific funds to improve mental health and wellbeing for both children and adults in our communities, and I will ensure that those are continued.
Okay, and briefly, Paul Sweeney.
Thank you, Deputy Presiding Officer. Is it not the case, Minister, that the Government has never met its target of 90% of children seen by CAMHS within 18 weeks, that in the last quarter almost 30% of CAMHS referrals were rejected? And how is the Government meant to be dealing with this positively when it's cut the mental health budget by 1% in real terms and a cash cut of £20 million year to year?
As briefly as possible, Minister.
So there's a few things to correct in that. I apologise, Presiding Officer. We haven't actually cut the budget. Let me be absolutely clear. The draft 25-26 budget increases the direct programme for mental health by 1.2% to £270.5 million. In the last 5 years, the direct programme budget for mental health has more than doubled from 21 to 26. Let me be absolutely clear that we are continuing to invest in mental health. The CAMHS performance is just outstanding. It is at 89.1% of children. In September, we met and exceeded the target. I would fully expect us to attain that target, and then the work will be on to maintain it and to make further improvements across the board in mental health.
Apologies for those I wasn't able to call. I call question 3, Jackie Dunbar.
To ask the Scottish Government how it is supporting NHS Grampian to increase bed capacity, particularly in light of increased demand during the winter period.
Cabinet Secretary.
Thank you, Presiding Officer. I very much appreciate the interest and involvement that Jackie Dunbar and other constituency members have shown in this issue. My officials and I have been meeting regularly with the leadership of NHS Grampian to progress both immediate steps and a sustainable plan to ease capacity pressures with a focus on improving patient flow through the system, preventing ambulance turnaround delays and discharging as soon as patients are medically fit. We continue to support and monitor all health boards to ensure all possible actions are being taken to support services and safeguard patient safety during the winter period, and planning for this winter builds on the effective measures which have supported our health and social care services in previous years.
Jackie Dunbar.
Thank the Cabinet Secretary for that answer. I understand that in colder months, additional strain and pressure on bed capacity is added to our healthcare services due to folk not being familiar with where they should access the most appropriate care in their individual circumstances. Can the Cabinet Secretary advise how the Scottish Government are working to ensure folk receive the right care in the right place at the right time this winter?
Cabinet Secretary.
Jackie Dunbar's question is timely, as it was part of this very issue was part of the visit that I carried out to the Scottish Ambulance Service in Edinburgh this morning, ostensibly to thank staff for the incredible work and the sacrifice that they make at this time of year, but also to demonstrate the very clear pathways that are available to patients over the winter period, when we all understand the pressures that there are across the system. So to ensure that people know where to seek urgent care this winter, we've relaunched the Right Care, Right Place campaign this October. The campaign has been designed to communicate the appropriate use of urgent care services, specifically accident and emergency, in an effort to help reduce pressures being felt across the system. The very clear messages are that for advice on minor illnesses and injuries, to visit nhsinform.scot. By checking the NHS Informed Symptom Checker, people can easily get the health information they need to safely treat their symptoms at home. To call their general practice or NHS 24 on 111 for non-urgent but non-life-threatening health conditions, and always to call 999 in an emergency.
Thank you. Brief supplementary test. What?
Cabinet Secretary, last week Aberdeenshire Health and Social Care Partnership emphasised that there has been no funding from the Scottish Government to support initiatives to manage seasonal pressures, and crucially added, as such, there are limited additional levers that can be introduced to manage surges in demand at this time. Given that NHS Grampian is already at crisis point, how can this SNP government seriously expect community health and social care services to tackle rising demand when they haven't been given the resources to address it?
Cabinet Secretary.
So this, obviously, the funding of our health and social care partnerships is not just for government consideration. These are local decisions that are taken by health boards and local authorities. However, my encouragement to all health and social care partnerships that have a plan for increasing capacity, that would wish to see greater support, our door is open to those considerations and those discussions, just as the discussions are ongoing with NHS Grampian as to a sustainable model going forward to respond to the critical incident that came forward. And I would encourage the engagement that we've been taking forward through the CRAG on a weekly basis to continue, so that those areas of concern, if there are any across the country, can be addressed either on a local basis or a national basis.
Okay, we need a bit more brevity, particularly in the responses, but also in the questions. Question 4, Oliver Mundell.
Thank you, Presiding Officer. To ask the Scottish Government what action it is taking to prevent the emergence of a franchise model of GP provision.
Cabinet Secretary.
So the Scottish Government believes that the independent contractor model is the profession's preferred model and is committed to maintaining that to ensure general practice remains an attractive profession. The GP contract regulations require all GP practice partners to be sufficiently engaged in providing primary medical services in Scotland, and the Government recently consulted the profession on whether the contract regulations are appropriate, and we're now analysing the consultation results.
Oliver Mundell.
I thank the Cabinet Secretary for that answer, but some GP partners are clearly abusing the system, putting themselves forward in multiple practices, not seeing patients, not involved in patient care, and certainly not present on site. I have one such example in my own constituency in Upper Nithsdale. I've raised it with the Health Board, and they point back to the contract, but I don't think it's sufficiently robust to make sure that patients are safe.
I very much appreciate Oliver Mundell raising this. Obviously, this is primarily a matter for the Health Board to deal with. However, where he has evidence of a situation like that, or indeed any other colleagues, I would be more than interested in seeing that evidence and seeing what can be done to address it.
Brief supplementaries. First, Colette Stevenson.
Thank you, Presiding Officer. I welcome the Cabinet Secretary's remarks on franchising. However, and alarmingly, I understand that many primary care providers, including GPs, have cited concerns in terms of the sustainability of their practice models following the harsh announcement from Labour's Westminster colleagues to increase employer national insurance contributions. Can the Cabinet Secretary therefore advise what steps the Scottish Government is taking to protect and increase primary care provision across Scotland in light of this UK Government policy, which essentially cuts public funding by the back door?
Not strictly related to franchise models, but Cabinet Secretary.
In terms of the sustainability of our GP practices and the sustainability of primary care service delivery, this is an area that is of grave concern to me and indeed to our BMA colleagues. Ian Morrison, the chair of the Scottish GP Committee, has described the national insurance rise as potentially a substantial blow that could lead to patients suffering. We estimate that the increase might cost between 520 and 580 million for directly employed public sector employees, and a further 210 million for those contracted out to deliver services and from the third sector. It is a significant issue of grave concern, and the UK Government must resolve the problem that has been made of their creation.
Thank you. And supplementary, Karen Walker.
Thank you, Presiding Officer. An Audit Scotland report on whether the 2018 General Medical Services contract has been working effectively is due to be published in April 25. Recent workforce statistics have shown there has been an increase in the GP to patient ratio, currently 1 GP per every 1,743 patients. Can the Government offer the public and doctors any reassurance that this worsening problem is in fact being addressed?
As briefly as possible, Cabinet Secretary.
So we remain committed to increasing the number of GPs in Scotland, and GP headcount is consistently over 5,000, with an increase of 307 GPs since 2017. I recognise that this is an issue, which is why we're taking forward the GP attraction and retention plan that has been welcomed by the Royal College and I believe the BMA as well, because we recognise that the record 1,200 GPs that are in training, we need to see them coming into practice. We need to see them coming into practice here in Scotland so that we can address some of the concerns that Carol Mochan has, and that is something that I am absolutely focused on delivering.
Question 5, Douglas Ross.
Thank you, Presiding Officer. To ask the Scottish Government what consideration it's given to the proposals from Save Our Surgeries, Burghead and Hopeman for a pilot to run a nurse-led service in the villages following the closure of their GP surgeries.
Minister Jenny Minto.
Thank you, Presiding Officer. The Scottish Government has carefully considered the Save Our Surgeries group proposal, but is unfortunately not in a position to fund the piloting of a nurse-led service in the villages. We have recently announced an investment of £13.6 million of immediate stabilisation money into general practice, and this money will support all GP practices to withstand cost pressures faced now and in the future, but means that there is no resource for pilot projects. The Scottish Government would encourage NHS Grampian and Murray Health and Social Care Partnership to ensure that the needs of patients are met following the closure of their GP surgeries.
Douglas Ross.
I have to say that's a disappointing response from the Minister. Health and Social Care Murray considered this last week and said they could look at it further, but only if the Scottish Government provided ring-fence funding for this. So can I ask the Minister to consider this again? And can she tell the Chamber what value she has put on this pilot? Because presumably, if she's ruled it out, she must know how much it was going to cost.
Minister.
I thank Douglas Ross for his question and also recognise the work that he has done to support the communities. Officials are also clearly working on guidance for boards and IGBs on branch closures. Stakeholders will be consulted in the new year, and we're also considering whether best practice guidance can be developed on exploring community-led solutions where delivery plans or estate strategies result in withdrawal of services for owned or leased buildings. So that's something I'm very aware of. And as I said in my initial question, the answer to Mr Ross's initial question, that money has been diverted into other areas that unfortunately this year doesn't allow us to put any funding into this pilot.
Good. Question 6, Michelle Thompson, who joins us remotely.
To ask the Scottish Government how its increased funding for mental health services will help improve access to psychological support for people with long-term conditions such as inflammatory bowel disease.
Mr Marie Todd.
Mental health is an absolute priority for this Government. Even in the context of the past few difficult financial years, we've continued to invest wisely. We have record numbers of staff providing more varied mental health support and services to a larger number of people than ever before, including providing psychological support for people with long-term conditions such as inflammatory bowel disease. The vast majority of spending on mental health is delivered through NHS board budgets. We expect NHS boards to deliver healthcare services that are safe, effective and put people at the centre of their care.
Michelle Thompson.
I thank the Minister for her response. She may be aware that last week IBD UK launched a new report on care for people with Crohn's and colitis across Scotland. And the report highlights that despite the severe impact conditions can have on a person's mental health, none of the 18 adult IBD services responding in Scotland met the IBD standards for multidisciplinary team staffing, including a lack of adequate provision for psychologists across all the services. Indeed, 4 in 5 patients reported not being asked about their mental health needs. To that end, what consideration has the Scottish Government been able to give thus far to the concerns raised in the IBD UK report, including the growing mental health need amongst people with long-term health conditions?
Minister.
The Scottish Government welcomes the recently published report by IBD UK. We'll carefully consider the report's findings to ensure that all people living in Scotland with IBD are able to access the best possible care. Our mental health and wellbeing strategy lays out our approach to ensuring that anyone can get the right support for their mental health, including people whose mental health has been affected by an inflammatory bowel condition. We published the National Specification for Psychological Therapies and Interventions in September 23, setting out the standards to which we expect psychological therapies and interventions to be delivered, including appropriate staffing.
And briefly, Pauline McNeill.
More than 50,000 people in Scotland live with Crohn's disease and ulcerative colitis. Scotland has the highest prevalence of any country in the UK. I know that the Minister is aware of this because she did attend one of our events last year. The existence of IBD nurses has transformed patients' experiences, such as Maretta, who spoke to the group. She lost her IBD nurse to her local service as a life-saving specialism. Can I ask the Minister if she is willing to meet with me and others to discuss the IBD nurse service? The specialist service has fundamentally changed people's experiences, their health experiences, and we need to ensure there's coverage across Scotland.
As briefly as possible, Minister.
Yeah, absolutely. I'd be more than happy to commit to that. I think it may actually lie within my colleague Jenny Minto's portfolio, but I'd be more than happy to commit her time to that endeavour.
Easily done. Question 7, Bill Kidd.
Thank you, Presiding Officer. To ask the Scottish Government what the expected health outcomes will be of the proposed increase in funding for Scotland's NHS as announced in the recent 25-26 budget statement.
Cabinet Secretary.
Thank you, President Officer. The recent 25-26 budget statement proposes a record £21.7 billion worth of funding for health and social care in Scotland, which will help get appointments quicker and receive treatment sooner. Our investment aims to improve patient experience, ensuring the journey from diagnosis to treatment to aftercare is as straightforward and stress-free as possible, and we've also committed to providing £200 million to reduce waiting times and improve capacity to make the system more efficient and reduce delayed discharge. As a result, we expect 150,000 extra patients to be treated by March 2026.
Bill Kidd.
Thank you, Cabinet Secretary. I welcome in particular that my constituents will benefit from an uplift of almost £400 million in direct investment in NHS Greater Glasgow and Clyde. Will the Cabinet Secretary therefore join me in encouraging my fellow MSPs on the opposition benches to support this Government's budget and ensure that our constituents across Scotland see the benefit of the highest ever funding for Scotland's NHS since devolution?
Cabinet Secretary.
Yes, I can. In answer to Jackie Bailey, I made this exact point, that we recognise that this budget is about addressing issues within the health service. The health service needs this budget to pass, and the opposition parties in this Parliament cannot just will the end, they must will the means as well. So the budget includes over £16.2 billion worth of investment in our health boards, representing a 3% cash uplift, a real terms increase on their baseline funding to support vital frontline services, and £139 million additional investment across NHS infrastructure, supporting improvement and renewal. It's a budget by Scotland for Scotland, focusing on delivering progress and laying the foundations for Scotland's long-term success, and one I would encourage all MSPs across the Chamber to support.
Question 8, Claire Baker.
Thank you. To ask the Scottish Government what it is doing to increase active patient registrations with NHS dentists.
Mr Jenny Minto.
Thank you. The primary aim of dental payment reform, as introduced in November 2023, is to improve access by incentivising dentists to remain in the NHS and thereby provide longer-term sustainability to the dental sector. Through payment reform, the Scottish Government has made a meaningful whole-scale intervention for the sector and introduced a realistic package of fees which better reflect the costs of delivering modern primary care dentistry. The latest official statistics show that almost 4 million courses of treatment have been delivered to patients since the introduction of reform up to the end of September 2024.
Claire Baker.
Thank you. In Fife, some 84% of the population are registered with NHS services, but that doesn't equate to access to dentistry. Only 63% of those registered have seen a dentist in the past 2 years, which means close to half the people in Fife are either not registered with an NHS dentist or haven't seen an NHS dentist. And in particular, while while almost 4,500 people in Fife are not registered with an NHS dentist, over 9,000 of these are children, and there are no dentists in Fife which are registering new patients. 4 practices are running a waiting list but expect waits to be over a year. So can I ask the Government what more they are doing? I understand that in Fife, Dunfermline, Glenrothes and Kirkcaldy have been included in the Scottish Dental Access Initiative. But what else are they doing, and when are we going to see progress in Fife to allow people to access NHS dentistry?
I thank Claire Baker for her question and recognise the issues that she has raised, and these are ones that we are addressing. We are working very closely with NHS Fife to ensure that they can provide, alongside independent dentists, the appropriate service. So, for example, there has been an increase in the public service dental workforce, and also the Health Board have provided a phone line. But also further to that, I'm working closely with colleagues across the UK, including the Minister for State for Care, Stephen Kinnock, to ensure that we can improve the number of dentists coming into the United Kingdom to provide these really important services that we need.
A very brief supplementary, Claire Hawkey.
I refer members to my register of interests. I hold a bank nurse contract with Great Glasgow and Clyde NHS, and I welcome the registration in Scotland is significantly higher than the rest of the UK, with more than 95% of Scotland's population registered with an NHS dentist. I recognise that recruitment and retention of dentists poses a threat to the accessibility to services for registered patients. Can the Minister advise what steps the Scottish Government is taking to overcome this issue, particularly in areas where the problem is most acute?
Very briefly, Minister.
It will be. I thank Claire Hawkey for her question. Initiatives under consideration include increased multidisciplinary working in dental practice to make better use of all our workforce. And as I indicated, we're doing cross-UK work to improve the number of international dentists.
Thank you, Minister. And again, apologies for those I was unable to call. We've gone over time a little, but we are pressed for time across the afternoon. That ends portfolio questions in health and social care. There will be a brief pause before we move to the next item of business to allow front benches to change.